If you're like most patients with gout, you may feel a bit overwhelmed by the diagnosis. You may have some concerns about how the disease may impact your daily life, especially if and when you may experience another attack. For many, avoiding the pain of another attack is enough motivation to follow doctor's orders. Your physician will work with you to find the right medication to treat your symptoms. A healthy diet and increased physical activity level will also be important. Keep in mind that about 2 out of 3 patients with gout will experience another attack within a year of onset, and 3 out of 4 will have another attack within the next 2 years. So let's talk about what's okay to eat. The Gout and Uric Acid Education Society has some easy-to-follow guidelines. The dietary guidelines focus on healthy food choices and a balanced diet. They're good to follow even if you don't have gout, and particularly if you are at risk for or already have diabetes, high blood pressure, high cholesterol, obesity, or heart disease. So let's talk about a healthy diet for gout. You want to start with colorful fruits and vegetables. Think oranges and bananas, and stick with all the colors of the rainbow for vegetables, either fresh or frozen. When it comes to bread, rice, and pasta, think whole grain. 100% whole wheat is best. When it comes to dairy products, low and non-fat are the best. Think about milk, yogurt, cottage cheese, and regular cheese, a good source of protein and calcium. And don't forget about nuts. You want to have them in the shell, out of the shell. They're great sources of protein and perfect for someone looking for a great protein source. Other good proteins are chicken, turkey, and fish like salmon and tuna. There are also foods you'll want to avoid when you have gout. Here are some examples. Shellfish like shrimp, scallops, lobster, and clams. Sardines, and especially red meat, as these foods are high in purine, a food chemical that can contribute to an elevated uric acid level, which can set the stage for a painful attack of gout. Another group of foods to avoid are those that contain fructose. That's mostly in processed foods that have a lot of sucrose and high fructose corn syrup. Anything from cookies, donuts, granola bars, and candy. And beware of sweetened drinks from teas to sodas, fruit juice, and punches. These are all high sources of fructose, so limit those as well. If you have gout, it's important to avoid alcohol, especially beer and hard liquor. For more information, visit gouteducation.org. You can also request a copy of the About Gout brochure to have as an easy-to-use reference tool. Your physician may encourage you to keep a food and activity log to help track what your personal triggers may be and develop a plan to help avoid flares. Check back often for the latest information about gout and how to gain control of your symptoms so you can live life to the fullest.